Today, I'd like to share with you a chronic total occlusion case that we just completed. Our patient is a 56-year-old male. He came to us with chest pain. He had a heart attack about 6 years ago. During that heart attack, a stent was urgently placed in his largest artery supplying the front of the heart. While generally symptom-free, he's had chest pain for the last 6 months, especially with heavy exertion. Because of this, he consulted us. We performed a stress test on our patient and found it to be strongly positive. Following that, we performed a coronary angiography. In the coronary angiography, we saw that the previously placed stent was completely blocked and decided to open it. For this, as we do in chronic total occlusion procedures, we placed cannulas called sheaths in both the patient's right and left arms. Then, with the catheter, we accessed the left and right systems, and as you can see here, we tried to visualize the blocked area and its filling from the other side by giving bilateral contrast. Look, here we see a previously placed stent. The vessel is blocked right in the middle of the stent, and with the dye we gave from the right side, we see filling up to the middle of the vessel. We do this in all chronic total occlusion procedures. In other words, we identify the stenosis or the completely blocked site by giving bilateral contrast. We did the same here and saw that the vessel was completely blocked over a long segment. We reached the lesion area with small catheters called microcatheters specially developed for this purpose. And with the help of special wires used for this procedure, we first crossed the completely blocked segment. After crossing the completely blocked section, we actually turn our procedure into a standard stenting procedure. Now we change those stiff wires we crossed with and replace them with the softer wires we use in normal stenting and balloon procedures, and starting from small to large, we expand this area with the help of balloons. We open the vessel. Then, since we didn't want to place a stent in this area, we applied drug-coated balloons starting from the distal end and moving towards the proximal section, which is the beginning part. As you can see, there's a very good opening. We didn't see any problem restricting the flow, and we didn't place a stent. We concluded the procedure by using a drug-coated balloon without a stent. Chronic total occlusions are truly the process of opening vessels that have been blocked for a long time. The success of the procedure varies depending on the materials used and the operator's experience. It can take a long time as a procedure, but with the right material and method selection, it usually ends successfully. In the treatment of chronic total occlusions, while stent implantation can be performed, the use of drug-coated balloons is another important treatment option.